the places we grew up in, we used to know if you got TB, there's going to be samples, and the samples are going to be sent a very long distance to come to a central hospital or provincial hospital. There are some places that are remote, and that would take a lot of time.
My name is Dr. Fungai Kavenga. I'm the Deputy Director within the Ministry of Health and Childcare. I'm responsible for TB control and prevention. Zimbabwe is struggling with a huge case detection gap. We miss about 40% of the estimated TB burden. We've already revised our TB diagnostic algorithm to include regular chest x-rays to high-risk groups and the use of AI in the interpretation of chest x-ray images. So the Ministry of Health has a national health strategy that is in place. Within this strategy, one of the key elements is integration of services. And we, as we offer health services to our communities, we do the health systems thinking, where we want to ensure that we have holistic approach to patient care.
The ultra-portable X-ray machines, they were procured mainly for the hard-to-reach areas. In Zimbabwe, we've got provinces, we have districts, then we've got rural areas. So we need to get this equipment to the deepest parts of the country so that everybody will have access to, diagnosis, proper diagnosis and testing and healthcare.
Here there are three key cadres who are important as far as we're implementing this: the clinician, the X-ray operator, and the hospital equipment technician.
So, what I'm more excited about is, the aspect of quality control. Now you get checks in terms of how you interpret the X-rays. It's like you are having another opinion by your side. So that would improve in terms of the quality control. We are excited about that.
I can give a scenario whereby in Zimbabwe we've got many mines and many people are working in those mines. So we were having issues whereby the team would be diagnosed late that they have TB. When it's detected, they will be resisting drugs. At late stage, that's when they'll be detected, and then that's when you will see that the person has TB. But however, maybe they'll be left with a few months or so to die.
The introduction of this AI equipment and this portable stuff that you can actually use in all those remote areas, I feel like it's a very big step forward, and it's one nose that we are putting towards the advancement of technology that is being experienced elsewhere. So to be part of it as Zimbabwe, I feel like it's a very big positive to us.
I think we should create a pool of what we call super users. Then this pool of super users will then be responsible for capacitating even new healthcare workers who come in, or refresher trainings at country level. And we believe this is more of like sustainable.
From what you have presented to the colleagues, to our participants, I think it has really met the expectations, and I think people were really looking forward to what IA can do, and I think they are actually amazed with the equipment and how you have demonstrated that it can assist there.
The training, it went well. We got to communicate, and I think it was very wonderful. The execution was okay. It was amazing indeed, actually.
I would say the training has been an eye-opening for us. We've got this general fear as clinicians or healthcare workers in terms of AI, artificial intelligence, coming into our healthcare system. But we get to appreciate, and the training was adequate. We got hands-on on the machine, and now we are fully equipped with the technical aspect, and we'll be able to cascade the training to other colleagues.
This technology, I'm so happy that we'll be able to use it, especially for TB patients. Due to its portability, I've seen that this machine, which will help us as radiographers to make our work easier. It's so easy to set up. It's something that you can set up within maybe, let's say, 5 minutes or so. The other big machines that we use in the departments can take up to 10 minutes, 15 minutes, some others up to 20 minutes. But with this one, I've seen to just take a smaller period of time to switch it on.
It's coming with a bit of training needed because we are adjusting from some very primitive stuff. We really have to take our time and learn and get to be handy with it. It's a very nice tool.
In Zimbabwe, we are moving from the time we had the fixed X-ray machine, the analog. We went to the digital. Then we had the mobile X-ray trucks, and now we have the ultra-portable X-ray machines. It's actually getting to everyone. The world right now is moving towards health for all. Such interventions would actually increase that probability or that accessibility to everyone to have the best healthcare in the country.
So overall, this technology will contribute towards our objective of reducing the incidence of TB by 80% in the next 3 years compared to a 2015 baseline.
In terms of patient outcomes, we are going to get more cases of TB being diagnosed. We are going to get less death due to TB. This is attributed to the fact that now AI software will then help more cases of TB are going to be screened. We're going to diagnose the cases earlier. So with that, we can intervene earlier and prevent these deaths. So in terms of outcome, it's going to be really beneficial.